Welcome to Boulder Community Health's virtual wellness series, Be Well. I'm Gina DeNucci, your host, and in today's episode, we learn the importance of normalizing conversations about sex. Next, we'll talk about why our diet culture may be causing harmful side effects. And finally, we will discover how to get the most out of your next massage experience. And be sure to stay with us until the end for the opportunity to win a proper picnic for two and paired bottle of wine from our friends at CEDRD in Boulder. Let's begin. I'm here with Dr. Nelson Trujillo, and today we're going to talk about sex and your heart. Dr. Trujillo, thank you for being here today.
Oh, Gina, it's such a great privilege to be here and talking about something near and dear to my heart, which is sex in the heart.
So, Dr. Trujillo, why do you think it's important to normalize conversations about sex with your doctor?
Well, the first thing to say is that, sexual relations are such a big part of the human condition. And there's such a taboo regarding any discussion about sex in general. And so when you add on top of that heart disease or any kind of disease and all the complications that can occur from that, it becomes quite the conundrum. And so having the opportunity to talk about sex, sexual relations, problems with sex with your physician can really, first of all, people are thinking about it. And secondly, what an opportunity to improve your quality of life. So I think, I grew up in the Dr. Ruth era, and we so appreciate how she normalized talking about sex. I think it's important to take that and bring it into the physician's office and caregiver's office because it's huge and it's important to all of us.
And when is it not safe to have sex?
So there might be times when we have to change how we think about sexual relations or maybe put them on pause while we address certain health concerns. As a doctor, we sort of define three risk groups. Those people who are very high risk for sexual relations, and that would include recent heart surgery, recent stent surgery, times when somebody's conditions might be unstable. That sort of predicts a very high risk group. We have intermediate risk groups where we want to pause and really understand the situation. And those are people with symptoms that we don't quite understand, significant cardiovascular risk factors. We talk about three risk factors like hypertension, high cholesterol, and diabetes that might be something to talk about with your caregivers before engaging in sexual activity, especially if you haven't for some time. And then low risk groups, which are most of us. The majority of people are safe to have sex. We sort of have a rule of thumb: if you can walk up 2 flights of stairs, it's probably fine. If you can walk 2 miles an hour for 2 to 4 miles, that's probably safe to have sex. So most of us, thank goodness, are low risk.
And let's talk about medications. This is a broad topic, but are there certain medications that can affect sex?
When we think about how a medicine might affect us sexually, there are sort of 2 broad categories. There's how would these medicines affect our libido, our desire? And then secondly, how would these medications affect our ability to have for performance? And obviously it's different depending on gender. When we talk about performance, for men, the ability to develop or sustain an erection; for women, lubrication, just our desire. And so medicines can affect both of those things. Sort of the notorious ones, are beta blockers in people with high blood pressure or with heart disease. That can affect both libido, since it does get into the brain and can make some people depressed or fatigued. And then medicines that reduce blood flow can, affect our ability to have erections in men. And then some of the estrogen and anti-estrogen related therapies can affect lubrication in women.
And last question I have for you, and this is my favorite question: what role can lifestyle play?
This is my favorite topic. And the answer is lifestyle is huge. Sex is part of lifestyle. we know that people that are men who have sex twice a week have reduced cardiovascular event rate. We know that women who are satisfied with their sexual partner have reduced cardiovascular event rates. So this is a good thing. The easiest things to do to get back on track are to exercise. We know that the safest way for people to resume sexual activity is if they exercise regularly. We also know that diet has a huge component in this way. Those people who eat, multiple servings of fruits and vegetables, sexual organs work better. It's better for erections. It's better for libido. We're less fatigued. There's less aches and pains that would get in the way of sexual relationships. So we actually can accomplish a lot with some very simple lifestyle maneuvers. Exercise regularly, more fruits and vegetables.
Thank you, Dr. Trujillo, for sharing your expert knowledge with us today.
Well, thanks for having me.
Hi, my name is Jane Reagan. I'm a registered dietitian nutritionist and a certified eating disorders specialist. I'm here today to talk to you about how to navigate our diet culture to achieve optimal wellness. Diet culture is a set of beliefs that makes people feel like their body shape and size is more important than their well-being. Diets don't work for a lot of reasons. Diets don't work because they're unrealistic. They're too low calorie often, and people go into a starvation state. People aren't liking the foods that they eat. Don't go on another diet. Find another way. There are lots of other ways. One of them is called intuitive eating, where you listen to your body, you listen to your hunger and fullness, you listen to your satisfaction factor, those foods that you like. You challenge those notions out there about good food, bad food, times of days of eating. You honor what your body is wanting. One of the most important things you can do is not starve yourself. I see people doing this all the time. They're under eating their calories, and it's causing them to overthink food. So one of the few questions that I can ask people to know automatically if they're under eating is, how often do you think about food? Most people should think about food when they're needing to go to the grocery store, when they're needing to meal plan, when they're needing to fix their lunch for the next day. People shouldn't be thinking about food 90% of the time or 95% of the time. But yet when I ask people, how often are you thinking about food? They will tell me they think about food 98% of the time. And the reason they're thinking about food 98% of the time is because they're hungry. What would happen if we actually honored that and ate when we were hungry and stopped when we were full? That's called intuitive eating. So one way to get away from diets and the diet mentality is to not follow them and follow other types of guidelines that are more flexible. One of those is called a plate theory guideline. So if you can imagine, divide your plate into 3 compartments, equal compartments, and 1/3 would be a protein-rich food, whether it be a plant-based protein or an animal-based protein. Another third would be some type of grain or starch, like rice or pasta or bread or quinoa or potatoes, and another third would be fruits or vegetables. And then add in fats into your cooking, so whether that's oils or nuts or seeds or avocado, and just have that be part of the food that you're making. And then eat your meal slowly. Put your fork down. Enjoy your meal. One of the things that people do that is often detrimental is they eat really fast. And so our bodies, our stomachs can't tell our brains that we've had enough food. So we think we're still hungry, when in reality, we just need to eat more slowly and let our appetite signal our brain that we've had enough. So another thing to think about is when you are going to make changes, make small changes that you can do consistently over time, rather than making big changes that you can't stick to. For example, I have many clients that try cleanses, and they'll do this for 2 weeks or even a month, and they lose weight, but they can't stick to it, and the weight all comes back on. It's better to make real changes that you can do for the rest of your life, and you'll be able to stick to, and then when you start to lose weight, the weight will stay off. To wrap up, the key components I would want you to remember is to not go on a diet. If you're someone that has dieted time and time again, reject the diet mentality. Try to not diet. try to go back to old-fashioned balance with eating balanced types of foods and listening to your body. And it may have been many years that you have thought about food and approached your food through thinking and measuring and logging. But what I want you to do is feel your way through your food. Feel what it is like to be hungry. Feel what it's like to be more full. Feel what it's like to taste food that is good and that satisfies you. And enjoy your food, because food is one of the most enjoyable things in our life, but yet it tortures so many people, and it doesn't have to. If you need help with making changes to your nutrition, reach out to someone. Reach out to a nutrition professional. This is a dietitian. A dietitian is trained in nutrition and how to make changes for greater health and wellness.
I'm Jonathan Grassi, board-certified massage therapist and founder of the Bodywork for Liberation Massage Clinic in Lafayette, Colorado. I've been practicing massage for 15 years, and I've built a team of master's-level therapists here. All of us at Bodywork for Liberation want your next massage to be the best massage you've ever had. I'm here to share our tips to help you get that experience. Massage is the best thing on the planet. That is something a client once said to me, and it's what I believe. What else can match the relaxation and relief that massage can offer? The return of ease, the unburdening of pain, the release of years of tension. Massage is the closest thing we have to the fountain of youth. Yet as you may have experienced, not all massages are created equal, and massage is an investment, so you want to get the most from your sessions. So how can you experience the best massage you've ever had? It comes down to three things: choosing the best therapist, being empowered as a client, and practicing the art of receiving. So let's start with choosing the best therapist. I recommend looking for the 3 C's. Commitment. Look for signs your massage therapist is committed to the profession. In particular, check to see if they have advanced training. This means they have specialized skills and may result in a better session for you. Comfort. No matter the therapist's skill level, they need to inspire you with confidence and calm. Watch a video of them if you can, or schedule a brief phone call. If you feel that click of connection with them, you're on the right track. Cost. Choosing massage as a part of your healthcare means that you may spend more time with your massage therapist than you do with your doctor. Your work together will help you live without pain and even help you possibly avoid surgery or recover more quickly from surgery. High quality care will yield a high quality of life. And isn't that worth investing in? So when you've done your homework and you've selected the right therapist, your empowerment during the massage session is crucial. Be sure to create clear goals with your therapist. Your massage is customizable to you. Let your massage therapist know if there are certain areas you do or do not want worked on, or if you would like more of a relaxation or a pain relief focus. The more you can define your goals, the more likely you will be satisfied when the session ends. Advocate for yourself if something isn't working for you. It can be hard to speak up sometimes. Practice saying things like, "What you were doing a minute ago felt great. You can lighten up the pressure a little right now, though." Or, if your ideal massage involves silence, try, "That great sensation you're creating is reminding me to go inside and focus." The trick here is to give positive feedback before you give critical feedback. Your massage therapist is there for you. As massage therapists, we want you to feel great, and we want you to come back. Please let us know what you need so we can deliver our best to benefit you. And when the technique is feeling just right, the next step is to practice the art of receiving. How you receive is what can make a session go from good to phenomenal. You can enhance your sessions by breathing into the sensations. Focusing on your breath, in particular your exhale, can help you relax the area that is being worked on. The massage therapist holds open the door, but your letting go is what allows you to experience that state of deep relaxation. Release your body weight. It can take practice, but as much as you can, let your body be soft and heavy. When your massage therapist moves your arm or your head, let it hang there. When you get familiar with this experience of surrender, it becomes extremely freeing and even blissful. And finally, acknowledge your massage therapist. Even if it's your 100th session, massage is a type of performance, so be sure to let your massage therapist know how it felt. That feedback will go a long way to motivate them to continue to do a great job for you for many sessions to come. At Bodywork for Liberation, we're giving back to our community. This year we launched the Healing Our Heroes program, which provides complimentary acupuncture and massage sessions to those who qualify. We've included firefighters, healthcare workers, teachers, and those who've experienced emotional trauma. To see if you qualify, visit our website.
Thank you for tuning into today's episode. And now for the opportunity to win a proper picnic for two and paired bottle of wine from our friends at Cured in Boulder. Be the first person to send me the correct answer to this question, and you're the winner. Here goes. What is the best way to empower your next massage? Send me your answers, and until next time, everyone, stay healthy and be well.